Today we are going to discuss the benefits of cold laser therapy, specifically in the treatment of bursitis. We'll begin with an overview of cold laser therapy, an assessment of bursitis, and finally a comprehensive treatment plan. Cold laser therapy, also known as low-level laser therapy or photobiomodulation, is a complementary modality most commonly used for its analgesic, anti-inflammatory, and regenerative effects. Laser, applied at a low level, is non-invasive and safe and works by affecting the impairment at a molecular and cellular level without heating the tissues, hence it's referred to as cold laser therapy. A recent article in Advances of Human Biology explains that these effects are a proven result of the laser's ability to inhibit the body's release of inflammatory mediators, reduce oxidative stress, and stimulates collagen metabolism to encourage tissue regeneration. According to an article published in the U.S. National Library of Medicine, the use of lasers for medical purposes began back in 1967. Since then, the use of lasers for rehabilitation purposes have become more and more widespread. The World Association for Laser Therapy was formed in 1994 in Barcelona, Spain, and is the leading body in the field. Their official journal is Photomedicine and Laser Surgery, and has published countless articles which provide results from randomized control trials. Some of these recent studies have proven the efficacy of low-level laser therapy for low back pain, shoulder pain, TMJ disorders, Achilles tendinopathy, musculocytis, and acute soft tissue injuries. The World Association for Laser Therapy develops and publishes dosage guidelines and recommendations based on impairments or diagnoses. For use in treatment, a low-powered 3B laser is applied on average for 1 to 10 minutes, twice or more weekly for 2 to 4 weeks. Clients sometimes report feeling a pulse or hypersensitivity over the area that's being treated. Typically, clients feel pain relief immediately after treatment and can last up to 24 hours. According to the CMTO policy, Schedule A, low-intensity laser therapy is recognized as an acceptable complementary modality to massage treatments. Cold laser therapy is an effective treatment for a wide range of impairments and is specifically indicated for clients with tendinopathies and for those with chronic pain and inflammation, such as what occurs with bursitis.
So for the assessment portion, I will be informing you about bursitis and how it's determined, potential contributors, and some impairments and limitations commonly found with bursitis. So to begin, a bursa is a closed sac formed of serous membrane that occur in locations subject to friction, which enables one structure to move freely over another. A common complication of a bursa is bursitis. So bursitis is the inflammation of one or more bursas causing pain, swelling, and restrictions of movement, which are commonly found in elbow, shoulder, knee, ankle, and hip, which results from trauma such as a fall or repetitive overuse of the joint seen in baseball or kneeling for long periods of time. So bursitis is determined by joint pain and tenderness, visible swelling and inflammation around the affected joint, reduced movement, redness, and a special test that can be used is bursitis differentiation, which this can determine between tendinopathy and bursitis. This is performed by increasing resistance during range of motion testing. If the pain increases when increased resistance is applied, it would indicate towards contractile tissue involvement such as tendinopathy, whereas if the pain remained the same, it would be an indication of bursitis. There are also other ways to rule out possible conditions that could be causing similar symptoms, such as x-rays, blood tests, CT, or MRI scans. Potential contributors to bursitis are rheumatoid arthritis, osteoarthritis, gout, diabetes, unhealthy weight, infection, or stress on soft tissues from abnormal posture, such as leg length discrepancies. There are also impairments and limitations that come along with this, which are, depending on the location of bursitis, there may be different limitations in ROM, such as abduction, lateral rotation, and flexion during active and passive movements. There may also be inflammation and edema in the joint area, and resting muscle tension in compensatory muscles.
Cold laser therapy. Treatment of bursitis. Treatment goal number 1. Reduce inflammation of the bursa. Use cold therapy to promote restoration of healthy bursa and local soft tissues. Once tissues are healed, pain is eliminated and normal range of motion and function is restored. Inflammation can also be reduced using superficial lymph drainage. Goal number 2. Reduce muscle tone in compensatory muscles using petrosas and neuromuscular techniques. Goal number 3. Reduce muscle tone in surrounding muscles using indirect techniques, using origin insertion, GTO techniques, and agonist contract. Goal number 4. Decrease fascial adhesions, using direct fascial, skin rolling, and myofascial release. Goal number 5. If bursitis is in chronic stage, reduce scar tissue, using frictions, passive stretch, and cold. A client with bursitis would have limited range of motion. As a therapist, you would want to maintain and improve the client's range of motion. If client is in acute stage, they can perform active-free according to their pain tolerance. If client is in subacute stage, active-free and passive ROM can be performed. If client is in chronic stage, any range of motion can be performed. You would make modifications to your treatment plan knowing if it is in the stages of acute, subacute, or chronic bursitis. Cautions: do not massage the bursa itself. This will cause pain and further irritation. It is important to pay attention to the client's pain level and their stage of healing and make sure to work proximal to swelling and edema. Some contraindications of cold laser therapy include: never treat unknown lumps or tumors. There is potential that the laser could stimulate the cells and promote growth. Do not treat patients that are on immunosuppressants because the light may boost the immune system. Do not treat directly over a bacterial infection. Do not treat directly over a pacemaker or any internal electronics. Do not treat a patient with epilepsy, especially with a pulsing laser that could trigger an attack. And that concludes our presentation on cold laser therapy and bursitis. Thank you.